Hi, Dr. J Crealese with Club Chiropractic. Today's topic is knee pain and some things you might be able to do at home to help it out. I've seen a lot of patients with knee pain, and one of the most common things I see is uncomplicated knee pain, meaning there's no damage to the inside of the knee necessarily, no meniscus tears, no ligament tears, there's not a lot of swelling necessarily, no warmth or redness. But anyway, a lot of these patients have kneecap tracking problems or patellar tracking problems. And what that means is every time you move your knee, bend your knee, walk, squat, climb stairs, your kneecap has to glide over the front of your knee. And there's cartilage on the back of the kneecap. And that cartilage is usually smooth as glass and allows the kneecap to glide nice and frictionless. Well, sometimes the kneecap starts to track improperly. And this can be due to an injury, it can be due to postures, it can be due to certain habits of climbing stairs or squatting. But anyway, what I find is a very helpful thing for a lot of these patients is to give them an exercise that helps to stabilize their kneecap and make it track properly. Now, the kneecap is a floating bone inside the quadriceps complex, and your quadriceps are four muscles that are kind of one big muscle all together in the front of your thigh here. And there's one part of it called the vastus medialis. Vastus means large, and medialis refers to medial or toward the center of the body. So this muscle is on the lower inner part of your quadriceps here, and it hooks into the upper inner part of your kneecap. And that is the muscle that controls proper tracking of the kneecap. And the only time that this muscle really works to its largest extent is when you have your knee in full extension, or the last 15 degrees or so of extending your knee. So if you want to tone the vastus medialis portion of the quadriceps complex, what you have to do is just straighten your knee as hard as you can, but do it slow and deliberately, and feel that contraction occur here in the lower inner thigh. And then hold it about 3 to 5 seconds, and then back off, and then do another one, and contract it as hard as you can, and build up to that severe contraction slowly. Don't get a cramp, don't do it so hard that something stiffens up. And if you do about 10 or 12 of those at a time, and do them a few times a day, you'll gradually tone up and strengthen that vastus medialis muscle, which controls kneecap or patellar tracking. And after a few days to a week or so of doing that exercise, you may find that your knee pain is a lot better. So I hope that helps. Always, actually, if you have knee problems, come on in and see us. Get evaluated, and let's make sure that it is a relatively uncomplicated problem and it is a knee tracking problem.